Good evening, my name is Abby Hitchcock and I'm a nursing student in the Leadership and Management program at the University of Alabama in Huntsville. My patient tonight is a 24-year-old male who does not have diabetes, however, who will be participating in this exercise. The first thing we will want to do is inspect the skin. We're going to be looking for any discolorations along the skin, which this patient has none. However, if he did have discolorations, it could represent poor circulation. The next thing we'll be looking for is varicose veins. Varicose veins are prevalent along the ankle, usually, and this patient has no varicose veins. If varicose veins are present, it could represent poor perfusion. The next thing we'll be monitoring is the hair pattern along his legs. His hair pattern is evenly dispersed, no patches prevalent. In men, it's easier to detect the patterns of the hair more than females because sometimes they are shaven. The next step, we're going to feel the skin. We're going to take the back of our hands and go down to feel the temperature of the skin. If there's any cool or cold places along the skin, it could represent poor circulation and poor perfusion. If there's any hot or warm spots, it could represent infection. Next, we're going to examine the foot for any lesions or calluses. There's no lesions present. You're going to want to check in between the toes. No lesions present on the heel. However, there is a small callus. If he was a diabetic, he would need to watch and make sure that callus does not crack open, which could cause an ulcer. And if there's lesions, he would need to monitor that daily to make sure they don't worsen. Next thing we would look for is any amputated toes. Since this patient doesn't have any amputated toes, then he would be fine. But if there was present, then he would be at higher risk for more amputations. The next thing we're going to check is our pulses. Check the top of the foot first. This is the dorsal pedis. It's present, 2+. Next, so posterior tibia. Also present, 2+. This patient has they were great pulses. If he was a diabetic, his pulses might be weak or faint due to poor circulation. The next thing we're going to be checking is for edema. This patient has no edema present. If he's a diabetic, he might have edema around the ankles. It's usually a prevalent spot. We would maybe classify that as a 1 or 2+. But with edema, it could represent poor circulation. The next thing we're going to be checking are his nails. Okay. His toenails are cut straight across, which is the proper way of doing it, and there is no discoloration within the toenails. If he had yellow beds, it could represent fungal infection, which an antibiotic cream could take care of, or antifungal cream. And also, we're going to want to be checking the capillary refill. This capillary refill is less than 3 seconds, which is the proper way. But if it was greater than 3 seconds, it would represent poor perfusion and poor circulation. The next thing we're going to be testing is the strength. I'm going to need you to push against my hand. Good. I represent 5. And against. Good. 5. Strength is well present along his foot. Next, we're going to be testing the monofilament. Hold your foot up, please. I need you to close your eyes and tell me when you feel and where at on the foot. Ready?
I feel it on my big toe. On my heel, on my toe, in the middle of my foot.
This is a small tool that I could send home with you that you could test yourself. It helps detect neuropathy, and this patient was able to identify the first 4 positions that I tested. Therefore, he has no signs of neuropathy. However, if the patient is not able to identify 4 out of 10, greater chances of neuropathy and further testing would need to be evaluated, such as the vibration test. I'm going to hit this. I will need you to tell me when you feel it and when you do not feel it. Ready?
I do feel it. It stopped. I do feel it. It stopped. I do feel it. It stopped.
Alright. He was able to perform the vibration test correctly. If the patient was not able to perform, it would also represent possible neuropathy. Another test that can be performed is the cotton tip test. I have one end that is dull and the other end that is sharp. I need you to tell me if you feel it and if it's dull or sharp.
It's dull. It's sharp. It is dull. It is dull. It is sharp.
Alright. He was able to identify all the positions and if they were dull and sharp. However, this is another test for neuropathy and sensation. The last test we'll be performing today is the reflex test. Alright. Reflexes are tested due to if the reflexes are not present, it could have increase for ulcerations within the foot. A few things that you will need to remember as the patient is to always check your feet daily. When you wake up in the mornings, you need to look at in between your toes and on your heels and make sure you don't have any sores or new calluses that are present. The other thing is moisturization. After bathing or showering, always remember to put lotion on your feet to help keep them moisturized to prevent cracking, which can turn into ulcers. The other factor is your toenails. Always cut your toenails straight across. Do not curve them, which gives you a higher risk if you do curve them for an ingrown toenail. By cutting the nail straight across and keeping them trimmed, it gives you a greater chance of not getting ulcers or skin tears on your feet. And also, if after you cut them, if you file them, it keeps them from being sharp. And another thing you can remember is wear protective shoes at all times. Always remember to wear shoes even in the house. That way if you stump your toe or you drop something on your foot, it can help protect your feet from getting scratches or bruises or sores on them. Another key factor to remember is to not put your feet in hot water. So with neuropathy, we have less sensation in our feet, and sometimes the water is hotter than what we realize. So by not putting our feet in hot water, we'll be able to not burn them and not cause further damage. Also, if you do have an open spot on your foot come up or sore, you need to contact your doctor immediately to get examinations and wound care provided. Also, always remember to take your medications on time and as scheduled, and to check your blood sugars daily. It's also very important to get an eye exam. Thank you for your time. Good evening.